Hello everyone. So let's discuss the previous year questions from NEET PG 2018 of anatomy. So our first question is identify the thickened nerve marked in the arrow in the image shown below. Here in the image we can see and identify this nerve very easily, that is the greater auricular nerve. So the answer is option A. Now, the next question. Broca's area is situated in, we know the mnemonic that Broca's area is situated, area number 44, and that is situated in inferior frontal gyrus. So, the answer to this question is option A, that is inferior frontal gyrus. Now, the next question. Which of the following cranial nerve nuclei is not a part of special visceral afferent? So, let's see the options. Facial nerve is the seventh nerve. Trochlear nerve is the fourth nerve. Tenth nerve is the vagus nerve. And glossopharyngeal is the ninth nerve. We all know that 7, 9, 10 is present in most of the columns and they are present with each other. Only the odd one out is here is trochlear nerve. So the answer to this question is trochlear nerve. Now the next question, that is the joint between the attachment of eighth and ninth rib to the seventh rib. It is a plain synovial joint. So the answer is option C. We will discuss the types of joints in one of the lectures. Now, which is the last fontanelle to close? Anterior, posterior, occipital, or mastoid? We have to know when these all fontanelles closed. Anterior fontanelle closes by 18 to 24 months of age. Posterior fontanelle closes by 2 to 3 months of age. And mastoid fontanelle closes by 12 months, and there is no fontanelle known as occipital fontanelle. So the answer to this question is option A, that is the last fontanelle to close, that is anterior fontanelle, which closes by 18 to 24 months of age. Now the next question, which among the following is incorrect regarding substance fossa? Substance fossa is attached to the inner border of first rib. Here in the option question, it is asked incorrect option. So we have to identify the incorrect option. Substance fossa. It is attached to the inner border of second rib. No, it is the incorrect option. So the answer is option A, because it is attached to the inner border of first rib. Let's see the other options. It covers the apical part of lung. It is true. It is a part of scalenus minimus muscle. True. Vessels pass above the fossa. Yeah, it is the true statement. The next question, the structures not passing through the aortic opening of diaphragm. For the openings in the diaphragm, we know a mnemonic I8, 10 eggs at 12. So, 38, the vena cava opening is there and the structures passing is inferior vena cava. And at T10, the opening which is there is the esophageal hiatus and the structures passing are esophagus, gastric vessels, and vagus nerve. And at T12, that is the aortic opening, the structures passing are aorta, azygos, and the thoracic duct. So the answer to this question is option D, that is vagal trunk, which is passing through the esophageal opening, which is not passing through the aortic opening. Now the next question, the hard palate contains which epithelium? The hard palate contains keratinized stratified squamous epithelium. Keratinized, so third and fourth option is cancelled. Keratinized epithelium, keratinized stratified squamous epithelium, and it has a submucosa. It has a submucosa, and minor salivary glands are present. So the answer is option A. Now the next statement, what is the function of the muscle marked as A in the image below at the metacarpophalangeal joint? So first of all, we have to identify the muscle which is marked as A. This muscle is the lumbricals. And we all know the function of lumbrical is to make the L. This is the interphalangeal joint and this is the metacarpophalangeal joint. And at metacarpophalangeal joint, we are seeing it is doing flexion. So the answer to this question is option A. Now the next question, which among the following is the tensor of vocal cord? We have to learn it. That is cricothyroid is the tensor of vocal cord. All the other muscles of vocal cord we will discuss in one of the slides. Now the next question, the nerve of the second branchial arch is. We all know the nerves of branchial arch. First arch, mandibular nerve. Second arch, facial nerve. Third arch, glossopharyngeal nerve. Fourth arch, superior laryngeal nerve. And sixth arch, recurrent laryngeal nerve. Fifth arch is not there. So the answer to this question is second arch facial nerve, that is option C. Now the next question, which of the following statements is true about iliopubic tract? It is the thickening of lumbar fossa. No, it is not the true statement because it is the thickening of transversalis fossa. It lies anterior to Poupart's ligament. It's also not the true statement, it is the false statement. It inserts into the pubic tubercle in front of the conjoint tendon. It is the false statement. And its fibers fan out laterally with fascia iliaca. It is the right statement. So the answer is option B. Next question. Urethric bud develops from. We all know that urethric buds develops from mesonephric duct or Wolffian duct in both male and female. So the answer is option A. The next question, that is, the heart starts to beat in dash week of development. We all know that heart starts to beat in the fourth week of development. So the answer to this question is option B, that is fourth week of development. Thank you so much.